Hi, I'm Dr. Heather Lowe, and I am a functional medicine practitioner. I'm a physical therapist, certified athletic trainer, and also a certified strength and conditioning specialist. And I'm here to talk to you about the benefits of functional medicine and a little background on my interest with functional medicine goes twofold. One, as a practitioner with a lot of rehabilitation experience, I've worked with a lot of different individuals for different injuries and concerns and conditions, and of course the goal is to get them back to what they want to do. So whether that is in the athletic arena, whether that's at home, maybe that's involving work or just recreational activity, we want to get that function back. And most of the time that happens really well. You know, we can get people back and get them back to where they need to be, and everything's great. But there is a small percentage of people where there tends to be some cycles of having concerns that will come back. And when that occurs, we have to look at a deeper level. And that's why I started looking into functional medicine a while back, because we need to figure out what else is going on in their system. Why is that constant irritant and symptom and problem that doesn't let us do what we need to do on a daily level interfere with us? So that was one part. And the other part is from a personal note, because I have suffered with intestinal issues, IBS, my whole life, and at times extremely severe, very debilitating. You know, you can't at times go to work. You can't go out and do things social. You're constantly looking at, okay, what can I eat, or what stress is triggering this, and it's very confusing at times. It's very upsetting, of course, because sometimes these symptoms just come out of seemingly out of the blue, and it can be horrible. So part of my goal was also for myself getting healthy, and that's occurred, and I'm so thankful for that process and how functional medicine has helped me with this. And while I look and help people on a variety of different levels, working with people, particularly women that have IBS issues, as well as low back pain, is a particular focus of mine, because we need to get that controlled on a deeper level. So let's talk about what functional medicine is and how that can help you. So we have to look at the root cause. What is the root cause of your concerns? And functional medicine is going to do just that. So it's going to go through a variety of components, and one of them is going to be looking very thoroughly at your history. And so this history is going to be not just physical, but it also includes emotional, mental, anything that's affecting you, your body, and your overall well-being. Because, right, it's all circle. Everything interacts together. So we need to look at it as such. So that is the initial part of it. And then we look at relationships. How are things going with coworkers, with your boss, with your partner, with family members, friends, social life? How is your stress with that? We all have stress, but are you able to modify your stress and bring it back into a nice, calm balance at the end of the day? Or is it something that lingers and it really affects your body on a very physiological level? Of course, what's happening with nutrition? Nutrition is key. We have to have good nutrition for our cells to work properly. Without that, we're not going to get out of some of the routine cycles that our body is potentially in at the moment. Of course, that also falls in line with exercise and very good quality sleep to restore and let that healing occur at night when we're in that REM sleep. So those are a few things that we're looking at within functional medicine, but also it's just extremely tailored to you. What are your concerns? What are your symptoms? And one of the reasons with functional medicine that we may look into doing other things, such as testing, and this can include genetic testing. You know, we all have different predispositions, but don't be worried about that predisposition, meaning that you necessarily have to have that happen to you. There are a lot of things that can be done to modify whether that gene is actually expressed and going to have an effect on you or not. So that's one thing that we can look into. There's other lab work that we can look into to get on a cellular level and determine what is the root cause of why the cells, why different organs, why the different systems of inflammation, oxidative stress, immune function, are they working together or not? And if they're not, then we're going to look at piecing those holes, filling them up and piecing everything back together so that it can run smoothly again. Okay. So with all of those steps going, of course, we're creating a plan. We're creating a plan that's very tailored to you and your needs and what do you want to do again, right? That's the end of the game here. End of the day is what do you want to do again and how do we facilitate that to happen for you, and how do we get out of that cycle? Because I've been there. I've definitely been in the cycle of just having routine, physical, emotional, at times mental different concerns that just kept going through, and there wasn't anything to be done for it except for symptom management. And there's so much more than symptom management. So that is what I am here to offer you. And if you would like to learn more, please look at the link down below and we can schedule a time to have a consultation, just a brief 10-15 minutes to talk about some of your concerns, and then from there we can go forward as it seems to be a good fit for you. So thank you for listening and stay tuned. I will be having other videos coming up, the next one being more detailed into exactly how we attain our optimal wellness. Thanks.